Lovely. So my name's Amy and I am the clinical lead for our service at the Royal Hospital for Neuro-disability on our brain injury service, so where people come for assessment and rehabilitation. And I've been working as a speech and language therapist now for over 20 years, and I absolutely love my job even after all these years. And there's obviously bits of it that I don't enjoy, like some of the paperwork or the processes. But I feel really passionately that it's such an interesting and rewarding job in so many ways. Day to day, it's really rewarding working with patients. I made a patient smile today by talking about football, and that was really rewarding. And then on a different level, I've recently completed research into an area of speech and language therapy in which I've become interested. So throughout my whole career, you can move around into sort of different things, different areas. And it's something that I think it gives you a lot back too. Okay, so my talk today really is to talk to you about how do you get onto a course and then what happens next. So everybody who is a speech and language therapist has passed an accredited degree course, and this can be an undergraduate degree, so it takes about 3 to 4 years, which would require A levels or the equivalent. So you can do, I think, BTEC level 3 health and social care, but you just need to check with each university how many UCAS points they want. So that's the undergraduate route. You've then got the postgraduate route. So if you've already got a degree in a subject that's useful and related, you can do the speech therapy training in perhaps less time, so in 2 years instead of 3 to 4. But they usually want you to have a 2-1 in your first degree. But again, talk to each individual institution, because if you've got enough or particularly relevant experience, that might differ slightly. All courses are registered with the HCPC and the RCSLT. So to make sure you're doing a course which is clinical, that leads you to be able to work as a speech and language therapist, you have to do one of those courses. There are other degrees that are similar that might do work on communication, but they don't actually have the clinical the component. So you need to just check that. So I had a good look. Every year I have a look and check that I'm up to date. And there's now 24 higher education institutions across the UK offering speech and language therapy, and that's gone up hugely since I qualified a few years ago. They offer undergraduate, postgraduate courses, part-time or full-time. So part-time's not that usual, but they do exist. And the best thing to do is it changes all the time. Different courses start to develop. So check the HCPC website or the RCSLT to look for the full list of places showing you where you can study. So most people still study through the traditional route of going to university, but something that SLT is starting to develop a bit more are degree level apprenticeships, so that you can train whilst working. At the moment, there are 3 universities that offer this, so Essex, Birmingham and Sheffield. It takes about 4 years, and it's a mixture of work-based and academic learning. But the difference is you're not a student, you're an employee. So you don't have a student loan, so obviously the costs are less for you. And the employer is responsible for paying you a wage, which is great, because then you can earn and learn at the same time. And while you're doing this, 20% of your week must be spent away from the workplace. So that's 1 day a week, the sort of equivalent of. And this might be blocks, or it might be a day a week. The thing to remember is that you don't necessarily apply for apprenticeships in the same way for universities. You need to look at different employers. So potentially hospitals or schools or healthcare centres close to those universities might advertise jobs. But if that was the way, this is quite a new way of qualifying, and it's still in development. So if you're particularly interested in that area, I'd have a look at our RCSLT website and perhaps contact those universities which offer the apprenticeships and see which institutions they're currently linked to, where they're taking their apprentices from currently, because that might give you a tip on who's sending people, who's employing apprentices. I'm really hoping in the future that this sort of takes off a bit more, because I think it takes that burden of just student loans and finance away, really, and it helps people who are living a bit more locally to where they might work to study. Okay, so what do you study in your speech and language therapy course? There's obviously, because we all need to come out with being able to do the same job or a similar job, we need to have the same background. So all courses will cover these things. So you'll do biology, so neurology, audiology or hearing science, anatomy, physiology and child development. You'll do psychology, so cognition, so what's normal cognition or thinking, How does it develop in children? So the children bit should be down there, because then you'll have to understand, well, what happens when it starts to be impaired. Mental health, and then you'll learn sort of basic counselling skills. You'll probably learn research methods and have to do a dissertation at the end. And that's really important because all SLTs need to be aware of good and robust research, because even if you're not doing it yourself, you need to be able to pick up a paper, a research journal that talks about something that you're using in your practice, and be able to critique that paper and say, well, actually, is that a good thing that I should be doing? Has it got evidence behind it? Other things that you'll study in more detail are linguistics. So that includes phonetics and phonology, which are the sounds that people make and how they make them. So syntax or grammar analysis, and language processing models. So how language is processed in the brain, understanding and producing language. And then you'll look at, so you learn about how does language and speech work in an unimpaired individual. And then you focus on, well, what happens when it becomes impaired? So you look at things like specific language disorders, both developmental and acquired, and voice disorders, speech disorders, all sorts of different things. And then you also focus on clinical studies, because we all have to come out and work in multidisciplinary teams in health, education, justice, etc. So there'll be a focus on things like professional development. What is current best practice? How do you weigh that up for yourself? What are the current issues and topics for SLTs and within potentially the NHS or education? And how do you make sure that your practice is evidence-based going forward for the rest of your career? So all of the courses will have clinical placements, and a big chunk of time is spent actually out working with speech therapists. And you'll do a variety of things. So you will spend some time just watching, observing speech and language therapists. One of my first placements when I trained years ago, I was sent into a nursery for normally developing children, and so just so I could have an idea of what they were doing, and I was sent out with checklists. So then you learn, well, how is an unimpaired 3-year-old communicating, which allows you to have a benchmark for when you meet children perhaps who've got an impairment. So you're out there watching or looking at people with communication impairments. You also learn clinical skills. So you might start to look at, well, how might you get involved in some assessment? You might be doing some of the therapy. And then as you progress through your course, you take on a few more responsibilities in your placement. So you might actually have a few patients that you see yourself. So you have your own caseload that you might see under the supervision of a speech therapist for the weeks that you're on placement. So the amount and type of placements and where they are staged during your course will vary depending on which university you're at, which course you're on. But there's a minimum number of hours set by the HCPC RCSLT that you have to do. So everybody will have the baseline opportunities. It just might be set up slightly differently. So for example, I know at UCL, if you're doing the postgraduate UCL, in the first year, you do everything to do with paediatrics or children. And in the second year, everything is adult. So that's how they divide up their course. Other courses are run differently and might be more integrated. And on all of your clinical placements, in different ways, your performance will be assessed by your practice educator, so by your SLT who's in that service. And they will talk to you, support you, supervise your practice, and then with you at the end, go through how your assessment scores and feed that back to your university. Okay, so applications. So undergraduate applications for a first degree need to go through UCAS like any other degree. So those of you who are perhaps in sixth form, it's probably time to start thinking about that now. If you want to do it postgraduate or part-time, then you need to contact the university themselves and check on their website what their application process is. Entry requirements really differ. It is a competitive course and there are limited places, but there are more every year. For example, I know there's a new course developing at Roehampton in London that starts, I think it started this September actually, so they've just taken their first cohort. But it is competitive and more students apply than there are spaces. But look at the list, look at the universities and look at what they want, because there is quite a broad range actually of what they expect. So I had a look a couple of weeks ago, and currently Birmingham is offering BBB, Sheffield is AAB, and City University in London is BBC. So there is some variation depending on how you think your A-levels might pan out, and maybe apply sort of for a range. So postgraduate courses, the other thing to think about is look at different universities might prefer different A-levels. it's quite a broad career, and you can have a range of different backgrounds, so linguistics or languages or science, but some might have slightly different slants to their course, or some might want more science-based A levels, some might want more linguistics. So just check with each institution and see. But it's quite a broad course, and I think it's really nice, actually. You can be quite flexible. It's a really nice mix of sort of medical science, psychology, sociology, and you can come from many different backgrounds. But the key thing to do is sort of check what each university requires, visit if you can, and try and speak to somebody in the department. So how to get a place? Okay, so obviously you need to get the grades. You need to write your personal statement. So you need to show there that you've thought about why is speech and language therapy for you. So thinking about some of the things that we're talking about today that Rachel's already spoken about, and that my colleagues will speak about later. Why is it of interest to you? You might have had a part-time job that's relevant, or done some volunteering, or you might have some family experience of somebody that has had to access speech and language therapy, or you might indeed have had to access it yourself. So think about who you've worked with, what experience you can draw. And like I mentioned, you can look at it. Sometimes we'll come on to it a bit later, but sometimes it's quite hard to get access to shadow SLTs. But what you can do is go and work, perhaps volunteering in a nursing home. So then you can look at the language and communication of normal aging, and then you can compare it with people who've had a communication difference. So it's quite good to show you've got a range of experience, and try and keep up to current issues and developments. So the RCSLT website's really good. It sometimes has hot topics in SLT that you can look at and think about. So you can have a think about, if you have an interview, you can answer those questions, or you can try and put something like that into your personal statement. Go to open days, ask questions. Undergraduate applications might not always have a face-to-face interview. It could be a written questionnaire, but you might have interviews, you might have group interviews, you might have written tasks, but you will be told in advance if you apply and then you get an offer for the next stage. They will tell you what you need to do. So think about things, so SLT hot topics and things to think about. So I had a quick look. Again, I had a look at the RCSLT website, and I had a think about what's coming up for us as SLTs and what are we currently thinking about. The impact of COVID is still there. There's the impact of long COVID, what our role is, people who have long-term, maybe cognitive or voice problems to do with intubation. Also the impact of COVID on children developing at that time. So 5 years ago, the cohort was born into COVID that are now all starting reception class, and how their speech language communication skills have been impacted by that time, by the closures of schools, by that social isolation. So it's still trickling down. And so SLTs are often at the forefront of dealing with some of these issues. Equality, diversity, inclusion, that's a really hot topic for us. We really need as a profession to sort of work on that, and it's changing slowly, because we need to serve the patients that we have, and that they are from, they are from a wide range, they are very diverse, so we need to reflect that back. SLT needs in the justice system. So as Rachel said, and I always find this statistic really sad and really shocking, but 60% of people in youth justice system have speech language communication need. And in fact, I trained just over 20 years ago, and that wasn't a big key area where we worked, and that has really taken off in the last few years, I think, as we just develop more awareness. So I had a quick look at the RCSLT website. So in September 2025, the UK Parliament Education Committee published a report on special educational needs provision, and it stated that the SEND system is at breaking point due to unmet needs, delayed support and fractured services. So there is an RCSLT response to that, because obviously we are part of the needs that are being unmet. So many children need speech and language therapy for various reasons, and there just isn't resourcing, and there's a delay. So obviously children are waiting longer, they're missing those developmental windows. So things like that to be aware of, particularly if we're going to interview. Talking about the SEND Education Committee is a really good thing to throw in. Thinking about, I thought about the wider NHS 10-year plan, which has been often in the press. And really the sort of summary of that 10-year plan is for services to move to the community, to move closer to the patient. So encouraging less service provision in hospitals and more back out at home and in the community. So thinking about how that would impact on resourcing, where the resources should be targeted. So and sort of expanding and developing community services, I guess, to keep people at home as much as they can be, rather than nursing homes, hospitals, etc. But of course, all this sits against the backdrop of wider NHS financial issues and funding and staffing. So it's really worth you knowing. Oh, just died. Anna, can you hear me?
Yeah, I can hear you. Yeah, we've lost your screen.
Sorry, my computer just died. There we go, it's back. So thinking about the wider NHS picture. And really interesting places to follow if you're still on Twitter are things like My SLT Day, SLT Peeps, Ask SLT, just to try and keep abreast. But even on the Ask SLT website, you'll get some ideas. Okay, so in your personal statement, which you'll need to write, you need to show that you understand the course and what showing why you want to do it, and that you have skills and experience and enthusiasm. So read about the courses. Try and make your application SLT specific. So don't sort of apply to psychology and SLT and physio. Think about your experiences gained. And remember, I said just think about your transferable skills. So again, working with normally developing children, if you've worked in classrooms or education and you haven't had a chance, you will always probably have come across a child that's got communication needs. But even in a class of 30, the needs are going to be different, even if people don't have specific SLT needs. So think about all your transferable skills, and then highlight them with the evidence. So think about why. Try and highlight what you've done and why it's important. One really important thing when you're putting in your statements are checking your grammar and spelling. And I'm a horror for this. Anybody that gives me a job application working as an SLT with really poor grammar and spelling, it just, we are experts in language. Now, obviously, if you've got a specific learning difficulty like dyslexia, make that known, because obviously that's slightly different. But make it as precise and accurate as you can, and proofread it. Get someone else to read it and make it interesting, because this is your chance to have an impact. Okay. So what skills do you need to be a good SLT? You need to be good at communicating. You need to be organised and have good time management. And it's really important, because it's really important to come in, do your job, but it's also really important to leave on time, because things like being able to get things done and prioritise mean that you have a good work-life balance. And wherever we work in speech and language therapy, we're giving of ourselves every day. It's you investing your sort of time, you're emotionally investing in your patient that you see. So it's really important that you're good at managing your time so that you get time out. You need to show that you'll be caring and compassionate, and have empathy. You need to be able to work independently, perhaps managing your own caseload, but also flexing between team working as well. So I work very much on my own. I organise my own caseload to see patients, but also I work with physios, OTs, dietitians, organising joint sessions, and we're all working with the patient at the centre of what we do. You need to be adaptable. Sometimes your day might not go exactly how it planned. So you need to be able to flex a little bit and show that you can be flexible without it throwing you too much. And that sort of links back again to prioritising, particularly in some of our settings that we work in. You might work in a hospital, an acute hospital, and in the day you might have a patient who clinically bumps up the list. So you have to be a bit more flexible with who you might go and see. You need to be keen to learn and keep learning. It really is a profession where we're encouraged to carry on doing courses and learning more, and maybe doing research and studying, and bringing more sort of to your job. And I think that's what makes it really exciting and what's kept me interested over the years. You need to be good at problem solving. So again, in some of the examples I might work with, some of the assessments that we use are designed for patients who don't have as many cognitive problems as I work with. But they're designed just for maybe purely language problems. But sometimes the patients I work with can't access the whole of an assessment. So we might pick bits out. We might try and make a big copy of it so they can see it and point different pictures. So problem solving and being creative as well. Creative at what you're doing so that you can make your input and your therapy so really patient-centered. But you also need to be responsible and accountable, because you are the one managing your caseload and you are responsible for your patients. Okay, so gaining experience. So we've talked a bit about this now, and it is crucial, but it might be hard to get access to. So like I've said, try and think a bit creatively. Rachel mentioned working as an SLT assistant, but you could work as a teaching assistant, a healthcare assistant, or a nursery worker, early years. Any of those jobs, like I've said, would have really huge transferable skills that you can talk about. You can do reflection on any reading that you've done. There's lots of books out there on these. I think I've got some at the end. Relevant parts of previous college or schoolwork, or any courses like this evening that you can talk about. Any personal experiences. So if you've got a grandparent who's maybe had aphasia or swallowing problems following a stroke, or a sibling, or yourself, or family member or friend who's had speech therapy as a child, think about that and bring that in, because you'll have some relevant experience for that. And then the other potential way to get experience is helping and volunteer at things like stroke groups or Headway or the Stroke Association. So thinking about charity work that you could do. Oh, and that's some of the books I was thinking of. So you can get quite a good insight into what it's like to have a communication impairment. So my year off was by some of these are a bit old now, but my year off was by Robert McCrum, and he was a newspaper editor who had a stroke, and it impacted his speech. So not his language or his thinking, but his speech was very slurred. He couldn't make himself understood, and he gradually worked on sort of improving that. You may be familiar with The Diving Bell and the Butterfly. So he was a Jean-Dominique Bauby. I think he was editor of French Vogue, and he had a big stroke and ended up in locked-in syndrome, where he could only move his eyes up and down. And by doing that, he could spell. He used his eye movements to spell, and he spelled out a whole book about what it was like to live with locked-in syndrome. There's a book about a career in speech and language therapist and what that means, or The Man Who Lost His Language by Sheila Hale. So again, her husband had a stroke, and he had language issues rather than the speech. And it's about her journey with him to retain his language. And there's lots in there about language processing and their work with speech and language therapy, and what they might do with somebody with aphasia. And then the last one here is written by John Diamond. So he had throat cancer, and it's a really interesting book because it's a different speech and language therapists often work with head and neck cancers. But it was really powerful because I think there's some passages in this book that really explain what it might be like to have swallowing difficulties because of the treatment he'd had, because he'd had part of the base of his tongue removed. He couldn't necessarily eat and drink safely. And I remember very vividly him describing a passage of what it was like trying to get some pear into his mouth and to swallow it safely. So it gives you a real insight, somebody who's able to tell you, I really want to eat, but it's really hard. Have a look at websites. So you've got the RCSLT website. There's lots of stuff on there. Okay, so thinking about interviews. Some at universities interview, others don't. You might have group interviews. And my top tips really are: research the place and arrive in good time. So don't be late. Make sure you know where you're going. Practice the journey if you need to. So be prepared for the common questions. So those questions will be: why do you want to be a speech and language therapist? Why do you want to come to this university? What experience do you have? Can you describe someone you've worked with or met with a communication impairment? So thinking about all of those and preparing your answers and practicing them. We've talked about recent news stories, developments and key issues. And then think about good questions to ask them. So really have a think about that university. You might ask about how the course is structured. You might ask about their clinical placements, something about the course itself. So you might not have a one-to-one interview. You might be asked to do some written questionnaires or tasks. So I remember being shown a video and having to write down what I thought, how I thought the patient was communicating. You might have group interviews and discussions about maybe an unrelated topic. And it might be they give you a topic like climate change with a certain structure. And you can't prepare for that. But what they're looking for is, well, how do you communicate in a group setting? Do you listen to others, but do you get your own point across? So it's about that balance, really, about not dominating a discussion, but also making sure that you contribute. And also check with them. I'm not sure now how many interviews will be face-to-face or whether people will do online interviews. I suspect now we've mostly gone back to face-to-face, but do just check with your institution. And if you do it online, hopefully by now people will have good experience of making sure we know how to do it so that it's effective and professional. So practice before, make sure your background's nice and plain, make sure that you look from chest up and the angles of the camera, etc. And just make sure you don't do anything irritating like keep scratching, but just practice. Hopefully people, if it is online, we're now all a lot more confident with that. Okay. And this is sometimes hard for us. We need to sell ourselves. We need to be really sort of self-confident, show that you can demonstrate skills, show that you understand the profession in a realistic way. So I would really say realistic. So don't get yourself bogged down thinking that you need to use specific jargon or terms for things, but describe things as you understand them. So it's much better to hear you say something like, oh, you know, there's a person that I've worked with who's had a stroke, and I find sometimes that they find it hard to get their words out, and they get stuck and they pause and they get a bit frustrated, and the word is there. And it shows that you actually understand what they're experiencing. Now, as speech and language therapists, we call that anomia. But actually, if you were to use that word, it might come across as, unless you really can show that you understand it, that you've just learnt the jargon. So it doesn't really show a realistic understanding. So think about the level that you're at. You're not speech and language therapists. So think about how you would communicate in that interview to make sure that you're giving sort of a realistic and genuine response. Be enthusiastic and be clear and specific. So there you go. Don't use them vocabulary that you don't understand. And think holistically. So we keep patients at the center of what we do. So lots of for example, the therapy that we do, we might try and change the speech problem, but we might also look at, well, how can we adapt to that? So somebody might find it really hard to get their words out, but actually they could point to some pictures. So we might take them to the cafe and practice. So we might be working on both things. We might be working on strengthening speech muscles to improve speech, but also using alternative ways to communicate at the same time. And you might also do things like really try and make therapy personal for that patient. You don't just turn up for every therapy session with the same set of pictures. So today I was working with a man who just loves football. So I just printed off Premiership logos and we had a session practicing writing different football teams. So it was really meaningful to him. I managed to get a couple of smiles, and actually he was really engaged for the whole session. So it's thinking that person-centered way as well. Okay, so these are, I've asked students over the years what were the common few questions that they had. So these are the ones we've sort of talked about. Tell me about a person you've met with a communication difficulty. Describe a communication breakdown experience and how you dealt with it. What challenges do SLTs face? So that might be about funding and resourcing. Describe an experience where you've needed good team working. So that doesn't need to be an SLT. That could be another context of team working, but you can say, this is where I've worked in a team, and actually I would be able to apply that in an SLT context. Thinking about your relevant skills and your relevant experience. And then they'll ask you things, maybe ask you extra things like, well, what is the role of the SLT? So hopefully after this evening, you'll be able to answer that. Describe how you dealt with a challenging situation. And that doesn't have to be linked to SLT, but again, try and link it back. And describe a time when you've had to give feedback to someone, because these are key things that we have to do as part of speech and language therapists. Other things they might do is they might bring in the service user to be part of the interview. So maybe somebody with aphasia. They might ask you about NHS values, which you can look up. You might have to watch a video and comment on a person's communication and maybe what strategies an SLT is using to help. They might ask you to give a short presentation or group discussions, as I've explained. Okay, so that's a bit of a whistle-stop overview. I'm going to stop sharing. Has anybody got any questions they would like? Oh, there's a couple in the chat. Let's have a look. What's the typical number of students per class? That's a really good question. I think you're going to have to ask each university how many they take on their numbers, because it does vary a lot. I think UCL, I know UCL because I've just been studying there. I know UCL, they only do postgraduate, but they have about 50 or 60. But other courses might be smaller. So you'll need to have a look and decide. When I trained, I had 7 in my class, but that was many years ago, a postgraduate course up in Sheffield. Do you offer any additional support for mature students? Not having direct. Well, no, because you need to be able to do that. You need to be able to do it. You can get support from, you can probably get some support from online. It's a bit like writing a CV. I would find anybody who's writing sort of CVs or professional job applications can have a look for you, because it will be very similar. But that's not something that I would offer. But you can ask people that are in sort of professional jobs to have a look. That makes sense. Any other questions? Is anybody about in the process of looking at UCAS at the moment? Okay. Yes. Oh, Asha's. Yes. Okay. And where are you applying to, Asha? Have you got ideas? Okay. Lovely. Okay. Oh, UEA. Yes. Yes. Up in, is that no? Yeah. So that's all over the country. So that's the other thing, isn't it? There's lots of courses all over. You've got a real spread there: Sheffield, Manchester, Leeds. So that's great. And that's good. So obviously you're doing undergraduate for that. Anyone else in the process of applying? Okay.
Well, we've got a question in the Q&A.
Oh, have we? Oh, right. Yes. Oh, I didn't see that. What's the question in the Q&A? And then we'll have a break. Yes. Okay. Do you think volunteering with a local charity for people with learning difficulties would be relevant experience? Absolutely. Absolutely, Jen. I think that would be a really good experience, because you will learn so many transferable skills. And actually, I have not talked about learning difficulties very much this evening, because it's not an area that I have a huge amount of experience from. But what I will tell you is that I have employed people in my team who have and I work in a brain injury inpatient hospital, and I've taken people who have been working in outpatient learning difficulty teams because of the transferable skills that they have. So absolutely, people with learning difficulties will potentially have speech, communication, language, cognitive and swallowing problems. So really, really good experience, definitely. Oh, another chat. Is the degree valid abroad? Really good question. Now, there's a reciprocal recognition. You'll need to go to RCSLT for the most up-to-date on this, but there's reciprocal recognition between countries such as Australia, New Zealand, Canada, I think. America, not so. If you want to work in America, you have to retake more exams. So you can do it, but you have to do some extra exams based on the American system. So yeah. Not sure I missed it. Does the hospital take on students' replacements? Yes, we do. We take on at the moment students from City and UCL, because obviously we're in Southwest London, and we sort of have links with our relatively close universities, and we are possibly developing those links with Roehampton in the future. So yes, we do. We take about I think we take 6 to 8 students every year. You will hear from some of our students. We're going to have a quick break.